I'll be presenting today's Radiopedia.org case in radiology, hepatic lymphoma. Case courtesy is demonstrated here, and the case link is in the description below. Presentation: we have a 75-year-old male who presents with an increased GGT, otherwise asymptomatic. Taking a look at the ultrasound of the abdomen, we have a hypoechoic spherical mass which is about 8 centimeters in diameter. It's located between the right and the left hepatic lobes, with a hyperechoic center and septa radiating to the periphery. There's a vessel coursing through the mass, which is prominent at its center. This is seen on Doppler. Again, we have this rounded, slightly lobular, hypodense, hypoenhancing hepatic mass seen on CT. It involves segments 4A, 4B, 5, and 8, and has thin, mild peripheral enhancement. There's also thin, enhancing septa. A branch of the right hepatic artery courses through the mass, and another one encircles its posterior margin. There's barely any mass effect on the liver, and there's no transient hepatic attenuation differences. THAD lesions refer to areas of parenchymal enhancement visible during the hepatic artery phase on helical CT. They're thought to be physiological phenomenon caused by the dual hepatic blood supply. Occasionally, they may be associated with hepatic tumors such as HCC. Also found on CT was a solid retroperitoneal mass. It was found between the left psoas and the inferior renal pole. It was isodense to the hepatic mass and exhibited the same contrast enhancement characteristics. At ultrasound, the combination of a large hypoechoic mass with a central scar, a central vessel, and radiating septa placed focal nodular hyperplasia at the top of the differential. At CT, however, the mass showed features most compatible with hepatic lymphoma, perhaps even primary, in a single retroperitoneal node. An ultrasound-guided biopsy was obtained. The pathology report revealed diffuse large B-cell lymphoma. Hepatic lymphomas can be secondary or primary, which is very rare. Risk factors include HIV, HCV with non-Hodgkin's lymphoma, organ transplantation, and immunosuppression. On CT, it'll be hypoattenuating, and on MRI, on T1 weighted imaging, it's hypointense relative to the liver, hyperintense on T2, and with contrast, there's a transient increased perilesional enhancement.